In this video, we are going to discuss Crohn's disease, which is a type of inflammatory bowel disease. To more videos, subscribe Med Simplify. Let's go into the video. Let's look at the pathology of Crohn's disease. It is a chronic inflammatory condition. Affects any part of the gastrointestinal tract from the mouth to anus, particularly terminal ileum and ascending colon. If it involves the whole colon, which is called total colitis. The smoking, which exacerbates Crohn's disease and increases the recurrence. Macroscopic changes of Crohn's disease. Crohn's disease bowel is thickened and narrowed. Deep ulcers and fissures in the mucosa produce cobblestone appearance. Can see intra-abdominal fistulae and abscesses, which reflects penetrating disease. Aphthoid ulcers in the colon is an early feature seen at colonoscopy. Microscopy changes of Crohn's disease. Inflammation extends through all layers of bowel. Can see lymphoid hyperplasia and granuloma cells. Clinical features of Crohn's disease. The major symptoms are diarrhea, abdominal pain, and weight loss. Constitutional symptoms are malaise, lethargy, anorexia, nausea, vomiting, and low-grade fever. Can cause bowel obstruction with colicky abdominal pain. Investigations. Assessing serum blood for anemia of chronic disease, raised erythrocyte sedimentation rate, ESR, and C, reactive protein, raised white cell and platelet counts. Hypoalbuminemia in severe disease, abnormal liver biochemistry. If suspected septicemia, blood cultures are required. Serological tests to reveal positive ASCA and negative paranuclear ANCA. Stool tests such as stools culture and fecal calprotectin and lactoferrin, which are raised in active disease. Fecal calprotectin is useful in monitoring of IBD. Endoscopy and radiological imaging. Colonoscopy and biopsy. Upper gastrointestinal endoscopy used to exclude esophageal and gastroduodenal disease. Small bowel imaging includes barium follow-through, CT scan with oral contrast, and ultrasound scanning. Perineal MRI or endoanal ultrasound scanned to evaluate perianal disease. Capsule endoscopy used in Crohn's disease when radiological examination is normal. Radionuclide scans can also be used. Management can be medical and surgical. To treat induction of remission, oral or intravenous glucocorticoids are commonly used to induce remission. Other than these aminosalicylates, antibiotics can be used to support. Exclusive enteral nutrition can be given. Anti-tumor necrosis factor antibodies can also be used. To maintenance of remission, azathioprine, mercaptopurine, methotrexate, and anti-tumor necrosis factor antibodies can be used. Surgical management used in following situations in Crohn's disease. If there are strictures, stricturoplasty or resection and anastomosis are used to treat. Entire colon and rectum spared or minimally involved, subtotal colectomy and ileorectal anastomosis can be done. If whole colon and rectum was involved, panproctocolectomy and endoleostomy can be done. In perianal disease, surgical drainage of sepsis and antibiotics like ciprofloxacin, metronidazole can be used. In this video, we discussed Crohn's disease. In the following videos, we will discuss another inflammatory bowel disease, which is ulcerative colitis. Thank you. To more videos, subscribe Med Simplify.